When you think about someone recovering from a stroke, your mind probably goes to the things you can see, like learning to walk again or struggling to speak. But there's this whole other battle, a totally invisible one, that can be just as devastating, and that's post-stroke pain.
And that's a really important question, right? For so many stroke survivors, once the immediate danger is over, a whole new challenge begins. It's a battle with a type of pain that feels like it's coming from nowhere. So what in the world is going on?
All right, let's dive into it. This condition we're talking about has a name. It's called central post-stroke pain, or CPSP for short. And really, just understanding what that means is the first huge step toward managing it.
Okay, so here's the key thing to wrap your head around. This isn't pain coming from a hurt arm or a damaged leg. The actual injury, the source of it all, is in the brain itself. The stroke causes damage that messes up the brain's wiring for how it processes sensation, and the result is very real, chronic pain.
And we are not talking about some minor ache here. Not at all. Patients use some pretty intense words to describe it. One person said it felt like 1,000 hot needles shooting through their arm. It's relentless, and it can show up months after the stroke, which makes it really hard to connect the dots at first.
Now take a look at this range, 1% to 55%. I mean, that is a massive gap. So why is it so huge? Well, it's because CPSP is notoriously tough to diagnose. There's no simple blood test or scan for it, and its symptoms can look like a lot of other things. This just goes to show how complex this condition really is.
So, the big question is, how on earth does damage inside your brain create the feeling of pain somewhere else in your body? It really is like the brain's wires get crossed, and scientists have a couple of main theories about why this happens.
The first big idea is what I like to call the broken volume knob theory. Think about it like this. Your brain has a natural system for turning the volume of pain signals down, but a stroke can damage that system. So without those brakes, that volume knob gets cranked all the way up and stuck there, leading to this constant, exaggerated feeling of pain.
Then there's the second theory. This one focuses on the communication line that sends sensation info up to your brain. If a stroke damages that pathway, it's like having a bad phone connection full of static. The messages get all scrambled, and your brain just interprets that garbled signal as pain.
Okay, so if the problem is basically faulty wiring in the brain, how do you even begin to treat that? Well, the first line of defense is usually medication, drugs that are designed to help fix those faulty signals.
And there are two main types of drugs that have shown real promise. You've got certain antidepressants, which seem to boost the brain's own natural pain-fighting chemicals, and then you have anticonvulsants, which work by basically telling those overactive, screaming nerve cells to just calm down.
And this isn't just a shot in the dark. Check this out. For one of those antidepressants, amitriptyline, a study found that almost 2/3 of patients got significant relief. That's a huge deal. And it really shows how changing the brain's chemistry can dramatically change how someone experiences pain.
It's also really important to talk about what's not the go-to treatment here. We often think of opioids for severe pain, but for CPSP, they're not the first choice. For this specific type of nerve pain, their effectiveness is all over the place, and they come with a whole host of other problems. But what happens when the pills just aren't cutting it? For people with that really stubborn, treatment-resistant pain, a whole new world of therapies opens up, stuff that goes way beyond the pharmacy.
This is where things get really fascinating. We're talking about something called neuromodulation. It's a fancy term, but the idea is simple. We're trying to directly retune those faulty pain circuits in the brain, kind of like tuning a radio to get rid of static.
And this isn't a one-size-fits-all approach. There's a whole spectrum here. On one end, you've got non-invasive options that work from outside the body. But for the most severe cases, there are also invasive, surgical options where electrodes are placed directly in or on the brain to try and restore balance.
But, treating this isn't just about fixing the brain's hardware. You also have to upgrade the software. And that's where something called cognitive behavioral therapy, or CBT, is so powerful. It helps people identify those negative thought spirals that make pain worse, challenge them, and build real-world strategies to cope and get their life back.
And we're even seeing some pretty futuristic tools pop up. Virtual reality is being used to basically trick the brain. By immersing someone in a totally different world, it can distract them from the pain signals. Plus, it's a great tool to make physical therapy more engaging and encourage movement.
Okay, so we've covered a lot, right? From medications to brain stimulation to therapy. What's the big takeaway here? what does the future of treating this invisible pain actually look like? The single most important thing to get from all of this is that there is no magic bullet. The best, most effective strategy is a mix-and-match approach. It's about combining medication, maybe some neuromodulation, definitely psychological support, and physical therapy, all tailored specifically to what that one individual person needs.
And that really leads us to the final and maybe the most important question we have to ask ourselves. As all these amazing treatments get better and better, how do we make sure they're not just treating a condition, but that they're truly personalized to the actual human being who's living with it every single day?